If you ever experience any pain at the base of your thumb or in your wrist in this region, it could be a Quervain syndrome or a tenosynovitis. In German, it's called a Sehnenscheidenentzündung, and it's essentially an overuse injury of the tendons of the thumb. Now, this type of injury is very typical for people who use their hands a lot for work. So I think physiotherapists or massage therapists, even carpenters, those types of professions. It can also occur in everyday activities. For example, nowadays we're on our phones more than ever, so typing on the phone can also cause the Quervain syndrome. So what exactly is it? In acute cases, tenosynovitis is an inflammation or irritation of the tendon sheath surrounding the extensor pollicis brevis and abductor pollicis longus tendons, which run into a tight canal at the base of the thumb. In chronic cases, where we don't address the issue and the pain keeps coming back, we can even lead to restructuring of the tendon itself, making it less loadable and therefore more likely to reoccur in the future. Okay, so now we know what it is, let's talk about treatment. In order to understand how to treat it, I'm first going to explain the load capacity model, which will give us a better idea of how these types of injuries occur in the first place. So the load and capacity model explains the difference between the load, what we are asking of the structure of the body, in this case the tendon, and the capacity, meaning how much they are able to handle. So this tendon has a certain capacity that it can handle. If we exceed this by doing too much of a certain activity, either through repetitive actions or very explosive weights or even a trauma, this can lead to damage and inflammation. Okay, so now that we understand the load capacity model, that gives us a good idea of how to treat it. Our goal is not to completely stop doing everything, but to restore the balance. So the first thing we should consider is how to reduce the load in everyday activities and in sport. For the thumb, the extensor pollicis brevis and the abductor pollicis longus perform extension of the thumb and abduction of the thumb. They also support in gripping activities and holding things in an extended position, for example, holding a frying pan. So these are the main types of activities that you should aim to avoid. A great piece of equipment that you can use is a thumb splint. This will immobilize the thumb partially and support it, which will then in turn allow the body to come in and heal and get rid of all that inflammation. In the gym, you may want to consider modifying or changing exercises so they're not so much involving the hands, or using compensation strategies, for example, straps. Once the inflammation phase has taken place, and this typically takes around 7 days for a tendon and a tendon sheath, and you will notice it in a reduction in pain and swelling. We can then proceed to restoring the capacity of the tendon. The way we do this is through exercise. In this video above, you can see me massaging with a trigger ball or a lacrosse ball the muscles and the tendons surrounding the wrist and the thumb area. This is to reduce tension and to promote blood flow, so as to speed up the healing process a little bit and modulate and manage my pain. Here you can see me performing an isometric abduction of the thumb, where I'm pressing the thumb sideways against the resistance. The next exercise is the isometric thumb opposition. I want you to take your hand, I want you to put your thumb and pinky finger or your little finger together, and then cup your other hand over the top, and then we're going to open those two fingers out. So this motion against the resistance. For these isometric exercises, we should be performing these for around 45 seconds. So pressing, holding against that resistance for 45 seconds. We're going to do 3 sets, and we're going to do that up to 3 times a day. I would recommend starting with this once every second day and seeing how it feels and how it develops. Important things to note is when we're training, pain during the exercise or a little bit afterwards, up to a scale of around a 3 out of 10, is acceptable. Anything higher than this, or where the pain is lasting for several hours, is an indication that we've done too much. So it's important to note here that tendon injuries are very stubborn. So if you're not noticing improvement straight away, or you notice that the pain is coming back once in a while and you're getting phases where it is more painful, this is perfectly normal, and it's really important to look at function as an outcome as well. So can you do more than you could do last week? Gradually, step by step, progressing the amount of isometric exercise and load that you're applying in your everyday activities and in the gym until you're back to your normal function. Other treatment modalities that you could potentially look at would be shockwave therapy, which is something that we offer in our physiotherapeutic practice as well. Oftentimes I see patients and they've been to a doctor with their complaints, and a doctor or somebody they know has recommended doing a steroid injection. This is not something I'd recommend doing, because the steroid anti-inflammatory injection will reduce your pain in the short term for around 8 weeks. However, it decreases the loadability of that tendon structure, thus exacerbating or making the problem even worse as soon as that injection wears off. Now, if you're feeling uncertain or confused, make sure that you check it out on our blog. We've got a lot more information there, or come down and see us and get some professional help. If you like this kind of video format, please hit the like button, subscribe for more information, and I'll see you guys in the next video.